little by little.
Little by little.
Little by little.
And at the weight that you see your form starting to break down,
Correct.
then that's when you want to say, all right, this is enough.
People, fourth?
Fourth.
This is the fourth. Raining today.
So here we are, guys. We're almost finished with his shoulder sprain, and he's basically showing me now the motion that is causing pain. As we go along the recovery of an injury, we're looking at how the muscle is functioning dynamically, meaning in motion, and at what point in his motion is he getting pain. So as you were telling me before,
So I'm getting pain like when I do the
bringing him up.
I bring it up, but once I bring it down, it's like I feel it like.
So he's got some pain right along the joint in here.
And when I take a shower, and I want like right there is.
Then you feel some of the pain.
I feel some of the pain.
All right.
It comes and it goes. It comes, but it's right there, like where you touched it before. It's right there.
How's
Right
that
there. Yeah, right there.
as well? Right there.
Yeah, I don't know if that could be the bone or that could be something where
How you doing here?
I'm.
This is okay?
No, that's fine. I'm starting to feel it right there. It's right there.
Okay.
Yes.
So we could see here, we already pretty much took care of the whole deltoid area.
Mm-hmm.
So we got some of the connection from the pec going right into the shoulder.
Oh, yeah.
This is your AC joint, your acromioclavicular joint. So he's feeling some of the pain right there.
Oh,
Okay.
he just pressed it.
Yep.
Oh.
So we're gonna go to work on that one today. All right.
People like when you mention medical terms.
Medical terms.
Yeah,
Okay.
medical
All right.
terms. Oh.
Without getting too medical jargon, we'll try to get to the injury. But yes, right in here, where he pointed to and the motion, there was a lot of involvement with the front deltoid and the pec major.
And
So-
this is picking stuff up over my shoulder.
Correct.
Okay.
So this is where we need to make sure that the muscle is functioning well and the tendon is strong enough. And the conversation we were having before we started the treatment is I want to make sure that he is doing the proper form with the proper weight. All right. I know we're inclined to push more or go more, etc. And with the sacrifice of our form, and then we pay the price.
Oh
Okay.
my God.
So you see, this is an area
Yes.
where we absolutely have to work on. All right.
And what is it? Does stretching is gonna help that out? You think, or is it something where?
Stretching is going to help you out, but the proper form. Remember, most of these sports injuries happen repetitively. So you have micro tear, micro tear, micro tear, micro tear, and then you get a big tear. So that's why I'm humming in on form. You got to do the right form. You got to do the right form.
When you were doing this last time, it wasn't hurting me as much. Could it be that
Different area today.
Different area today.
Different
Okay.
area today.
Okay.
So I'm gonna go through here. This is the area that we worked on last week.
I
the
don't
front
feel
deltoid.
anything. I don't feel anything.
He's pretty much good in the front deltoid. I'm gonna cross through, but then I'm gonna go ahead and I'm gonna focus in here because that's exactly where he pinpointed the pain. As we go through this procedure, one of the things we notice as we start to clear certain areas out, a person will feel a specific point that we hadn't worked on before. This is the example that he's telling me. This is where the dysfunction is. Now that everything's healed, the body's registering what's still dysfunctional.
Wow, amazing.
That's the body, man. It's amazing. Yeah, this feels practically nothing.
Yeah, I just feel that the metal. I don't feel any like discomfort or anything like that. I'm probably a little sore too.
Yeah, his reaction is also pretty good here.
No redness.
Very, very mild.
Very mild. Okay.
Mild
It's probably
redness.
because of the soreness that I feel. But it's not
And
like
I'm
nasty.
looking at the also the way that the tissue is behaving, and it's pretty smooth.
Okay.
Pretty smooth here. So I'm gonna go ahead. I'm gonna put him in a different position. So lay on your back, Gizzy.
Okay.
Face
Let me
up.
just,
Head goes this way.
You guys can see that. Okay.
All right. So what I'm gonna do is I'm opening up the pec here. and I'm gonna go to work right in this area. And he does feel it right there. So I gotta take the muscle in a different action here, so I can target it well. And absolutely, there it is. So I'm gonna just bring the phone here close by. All right. So we could see right there, it's went red already. So I could tell just right off the bat. I didn't do too many strokes in this area, and there's a lot of redness. So we know that's the area I need to go to work on.
Okay.
Yeah, this one fired up like this quickly.
Oh wow. And you know what? I don't really feel that much pain. Is it because of the way that my hand is being, laid down, that I don't feel it that much?
Yes, and this is a pretty large muscle in here.
Okay.
Now, what you got to remember is we're after pain, but we're also after function. Probably the most important thing that we're going to do here is restore your function.
Okay.
All right. So he's not feeling a hell of a lot of pain in here, but there is the dysfunction. So we're going to have him do the move again in a little bit once I'm finished here, and we're going to see how it is. But definitely, this is an area that we overlooked because of how much injury was in here. But here, this is clean. This is fantastic. And like I was saying before, the whole thing about him getting back to CrossFit properly is making sure that he's lifting the appropriate weight and the appropriate form. I sound like a broken record because that's what most people need to do. All right, you need to go to the gym and don't be a crazy head, or go to CrossFit. Don't be a crazy head and put 4 plates on each side to impress the ladies next to you there. All right. Because then you have to end up here and go through some torture.
Yes.
And I'm more than happy to provide it, but we want you to work out injury free. As I tell the patients and all the athletes here,
right there.
you need to work out intelligently. Use your brain first, body second. We're almost done. Okay, that is pretty good. I'm gonna just bring it close again, so you could see where.
Oh my God.
Let's see.
Oh my goodness.
All right, so if we get that angle,
yes, I see it.
you can see that there's an area that we needed to work on.
Wow.
So.
Wow, it's like right by, it's like touching the bone.
Exactly. It's right the connection
Yes.
of the joint.
Yes.
Purely the whole connection here.
Oh my
So,
God.
using him as an example, most shoulder injuries that I see here include the deltoids and a little bit of the pec major. Because we are using this area a lot when we're doing any type of overhead activities, any benching, even when we're doing pull-ups, we're using this area. Dips, we're using some of the pec.
Yeah.
So this area, we need to make sure that we check it as well. Okay, so let's get you standing up, Gizzy.
Okay.
And let's just have you do, that motion again and see how it feels.
So I'm gonna do this. Use your, and then you go down. Oh yeah.
All right. So what
Am I
I'm
not
doing?
supposed to feel a little bit discomfort?
Maybe a mild discomfort,
Yes.
but you didn't feel much.
I don't
So-
feel much. I mean, I'm not gonna say, yo, I'm cured. But it does, like, it made a difference. Like,
And
let me. I still feel it right. I still feel it when I do this, but I'm trying to stretch it all the way over here.
same area. Let's see. Is it more there?
No. Let me see.
Go ahead.
It's right like in the inside. It's right like in the inside. Not. It's around. It's right there.
Right there.
Right there. Yeah.
Okay, so lower
It's
it
right.
down.
Oh yeah, right there. Right there.
Okay.
Oh yeah, right there. Ay, coño. Oh.
This one's gonna get a pressure point.
Oh. Oh my God.
Okay, lay back down. Let me do a pressure point on that one. So, what I just finished doing is we took him in the motion that was creating his pain,
Oh my God.
And what I expect to see in every visit is a reduction in pain in the motion that he has. Again, we're looking for the functional improvement. Many times, this is not a one-shot therapy that is going to cure it all, because we got to let the tendons and the ligaments and the muscles heal. So he had less pain here, but he had pain, which we call an internal adduction of the shoulder. So I'm going to do a pressure point in that area because I feel that's what he needs.
Oh shit, yes.
Okay. 5, 4, 3, 2, 1. Okay. I'm going to do one more of those.
Oh.
4, 3, 2, 1.
Oh.
Okay, I think I've tortured him enough on the shoulder today. So let's just do a retest again, and let's see how you're doing.
Okay.
Let's just see if we've decreased the pain going towards the inside.
Still it's kind of just lingering.
Lingering, okay.
It's lingering because I don't feel it here. Look how far I'm going over here. I
Mhm.
don't feel it. With this,
There's a lingering pain.
there's a lingering pain, right?
So here's what we gotta do. Next week, when I work on him, I'm gonna target a lot that area. We're gonna let this area clear up, and we're gonna tackle this
It's right
section
there.
right here. So the remaining pain that he has is going in. So we're gonna target his shoulder with some internal rotation therapy.
Ooh.
Okay, but that's good enough for today. I already tortured that area.
So it's not about torturing. It's about, it's a little by little.
Yeah, I can't abuse this shoulder. I mean, let's get a little closer.
Oh
okay?
yeah.
So I've done enough work in this area. I've done enough work in here. Now it's time for the body to take over and repair, allow for new fibers to heal. So I can't kill you. I already did enough.
That's how I'm able to get better throughout the week.
Yeah. So
Okay. Because I feel less pain.
you got to remember, absolutely. You got to remember, the body needs time to heal. My therapy is going to work and it'll continue to work, but I need to also understand that time will heal this area. We need to give this body time. Rest, all right? He's doing some of his workouts, all right, but he's also resting. He's not going really heavy, and you're not abusing. And I was telling him before we started the video, most workouts you need to finish. If you're benching, you need to finish with your arms at 90 degrees. So this joint is safe. The minute you start hyperextending this joint, you're going to create micro damage. No matter what exercise you're doing. And you may not feel it the first day, you may not feel it the second week, etc. You accumulate. I remember when I was in high school, a long time ago, we used to just bounce the weights right off of the chest. Boom, boom, boom. Very bad.
Yeah.
I don't know, we were creating micro tears, but this is what we saw people doing at the gym.
Correct.
So monkey see, monkey do, all right?
Correct.
So now you gotta understand, 90 degrees, all your exercises, when you're up here, 90 degrees, okay? Make sure you're not hyperextending your joints. Hyperextension of your joints will cause micro tear,
Okay.
all right? So that's good enough for that area. Let's take care of the ankle.
The ankle, you want me to stand up again or?
We're gonna do standing today, yep.
Standing, okay. The ankle, I don't really that much, to be honest. But when you talk about that, we also have muscles in our in our legs. That's where I was surprised.
So why don't we turn around and we'll let the crowd see your ankle. Let's
Oh,
turn
okay.
you face that way. All right, so here we are. I have him standing on this step stool, and we're gonna see how he reacts today.
Oh, yeah.
He's probably gonna feel some pain here,
I do.
but we're gonna distinguish between from last week to this week. How better is he tolerating?
Do you want me to put the pressure there?
You're okay here.
I'm okay. Okay.
Yeah, you're perfectly fine.
Okay.
So what we want to understand from this therapy that we're doing now, we're weight bearing. We're putting all the weight on his ankle and we're working on his ankle. We are mimicking the environment that he's in. He's in an environment where he's pushing a lot of weight. So now I got to take it to the next level and work his ankle. in such a position that will allow him to lift the weight, do the burpees, do the squats, and etc. Everything that gets done at CrossFit. So we're gonna see how he reacts today. Again, we're targeting the ligament pain. All right.
Ligament.
So let's see what he's got. Let's see how we're doing.
Oh, right there.
Right here.
Yeah, right there.
Now, for those of you watching here, this ligament is in pretty good shape already.
Yeah.
No pain, right?
No pain, no.
All right. This is done. This is completed work, and it feels great. There's no problems. His posterior ligament, any pain here, or just a tool passing through?
Just the tool passing through.
All right. There's nothing for me to do there either. So what we have left is this piece up here. Okay. Feel some pain right there?
Yeah, more towards the left down. Right there.
Right there. Okay. Now, front ligament,
Nothing.
beautiful.
Beautiful.
So we're almost wrapping this thing up.
Oh!
So he's got a point right here. He's got a piece of this ligament, and he's gonna start singing songs. I don't know which ones, but he's gonna start singing. All right, bring the foot out a little bit. Just bring it out.
Okay.
Bring it out a little bit more.
Okay.
So there you go. Perfect. So I'm gonna get a better angle right here. Okay. So we're gonna work this area out. Small area, but this is the one that can haunt you. All right. This is the one. I don't know if he's gonna sing in English or in Spanish today.
Oh my God.
So Gizzy, we appreciate you going through this process and teaching your people what it looks like to heal from these injuries. Now, guys, here's the important thing about doing this work. This is painful. This sucks, to be honest with you. I've gone through it. I've had sprained ankles, torn. I even tore a hamstring tendon playing soccer. This is not fun to heal from this, okay? But this is the fast way and this is the appropriate way. We talked about last week, resting stuff out doesn't work. That's old school, man. That doesn't really work. You gotta heal your injuries, all right? Once you heal your injuries, then your function will return and you will prevent your injuries. But if you leave injury dormant, it will haunt you the next time you try to do some good workouts, or you want to run a race, or you want to do CrossFit, or you want to do kickboxing, whatever it is.
Oh, right there. It's right there.
And I can feel there's a little section right there.
Yes, it's right
This
there.
part of the ligament. This is probably the most injured area when he sprained his ankle. So I'm working on it. It's not bad at all, though. I know it's painful, but very small area.
It's not that bad right now.
Very small area. See, it loosened up.
Yeah.
There you go. It loosened up.
Yeah.
Yep, there it is.
Yeah, it's crazy.
So I felt this. I mean, this takes some time to understand and to feel these injuries, but I felt the release of the ligament. It was all tightened up and not much pain anymore, right?
No. I mean, I don't know if you're doing it less or whatever.
Nope, same area, man.
Yeah.
Same area, same sensitivity.
I mean, there's still a little bit that I feel, but it's not as aggressive as.
It definitely loosened up. It let go. So what I'm gonna do here is I'm gonna tackle this with a pressure point because I did my job with the tool.
Okay. I'm good there.
Here we go. Any pain there?
No pain. I mean, just the pain that you.
Pressure from my finger, right?
Right there.
Oh. So here's an area right there. 5, 4, 3, 2, 1, 0. I'm gonna do 2 more of those, and then we're gonna be done. I like how this is coming along, man.
Yeah.
Oh yeah, brother.
Okay, good.
Real good.
I'm almost there.
You're almost done. All right. 5, 4, 3, 2, 1, 0. Okay, and one more. 5, 4,
right there.
3, 2, 1, 0. Perfect. Okay. So we're done. That's it. Torture's over. The good thing about this therapy, if there's something positive, is it's painful, but it's quick. We're not gonna sit here for an hour and do this. Okay, that would be cruel. So Gizzy, we are done.
I feel like this is like almost to the end it's
Practically.
it's one of the whatchamacallit, the most painful. Like I feel like I got pain. I feel like this last one when you were right
The
there.
pressure point, right?
Yeah, it's where I felt the most type of like pain.
Yeah. All right, guys. So basically, what's gonna happen next? He already did his laser therapy. I'm gonna have you do some of the Bozu. All right, so you can bounce out.
Yeah. I'm actually doing very well on that too.
You're doing very well on
Yeah.
that. And you have one at CrossFit. You guys have some of those, right?
We have some of those, but you know, you've been telling me not to do crazy stuff, so
Okay.
I'm chilling.
All right. So we're gonna give him some tape, and we're gonna get him to do some rehab, and then next week, hopefully, this ankle will be wrapped up,
Yeah.
and we'll hit this last pressure point. So
That's pressure.
thank you for listening, and we'll see you next time. GizzyCredit.com. Dr. Alex Hernandez, 84th and Kennedy Boulevard. I specialize in spine and sports injuries.
There
Thank
you
you for
go.
listening.
Thank you, my people. GizzyCredit, watching me suffer. It's all good. I'm getting better.